here to talk about HIV/AIDS. This could be historic, David. I don't think delegates here have ever heard from an adolescent like yourself. What is your perspective about HIV/AIDS?
There's a time when you get tested, you'd get a wristband, a glow-in-the-dark wristband, and I really wanted that wristband. So I decided, let me go get tested. Not because I thought that I could get HIV, but I wanted the wristband. So I go to the testing center, and I meet this lady over there. And I'm like, hi, I want to get tested. And she asked me, how old are you? I'm 16. And she, for, I don't know, lack of guidance or policies for us, she attacked me. She starts asking me, why are you coming to get tested? What is this that you've been doing that makes you feel that you are at risk? Does your parent know you're here? Go back and get your parent. And I just felt bad. I felt embarrassed. I felt like I'd been attacked, like bad cop. And for that, I didn't get tested. I think the reason why there is the increasing number of new infections among adolescents is the fact that we're not able to access the services. We're not able to access the testing, the counseling. We're not able to talk to anybody because for a long time we have been forgotten. Everybody thinks that there's some force field that is just protecting us from this. But the truth is, there's nothing.
We are here to draw attention to an alarming trend, an urgent challenge. Between 2005 and 2013 around the world, deaths due to AIDS decreased by nearly 40%. But there was one age group in which deaths did not decrease, 10 to 19-year-olds, adolescents. To stop AIDS deaths and new infections among adolescents, we must do three things. We must work more closely with adolescents living with and at risk from HIV. That means listening to their needs, involving them in the design and delivery of services, and empowering them to hold us accountable. Two, we must have reliable data, broken down by age and sex, so that we know who the adolescents most at risk are and where they are. And we must apply the data as well as what we hear from young people. Finally, we must increase access to adolescent-friendly services to prevent and treat young people with HIV, as David informed us this morning.
In your view, Pablo, and the microphone is right next to you, tell this gathering what the youth and adolescents particularly can bring to the All-In campaign.
By having informed programs from adolescents, then we will have better programs that are really targeting the needs and the realities of adolescents. Sometimes when we develop programs, we try to guess what are these needs and how can we reach these populations, and then we design programs that probably in the end are not going to reach adolescents. So by really having effective strategies that will bring adolescents to the table where they feel comfortable about what are their real needs, then we will have a really smart investment.
Some of these challenges are lack of information on sex and sexuality. Some of us do not know why we are taking the drugs. There is more stigma and discrimination in the community, schools and at homes. And we need to be treated as children.
Thank you very much, Mercy and Pablo. I think when we talk about a response that includes all different stakeholders, we are talking about being able, first and foremost, to get organizing and coalescing of adolescents together so that they are able to give us direction on what works and what doesn't work for them. I think the second thing is that we are able to work with different sectors, whether it is information, technology. Currently, most adolescents get their information from a lot in the social media, YouTube, internet, and as well as also be able to engage the Ministry of Education so that whatever structural interventions or structures are in place can be applied to engage adolescents in delivering services and in being able to figure out how best to reach them.
As David Mutaha said in his opening remarks, he is not a child, he is not an adult either. So we're seeing adolescence as a transition, but a very critical transition which is individualistic, which means has different meanings in different cultures. But the end product is that it is a transition from childhood to adulthood, which should be supported. Now, in Eastern and Southern Africa, that support comes in the form of comprehensive sexuality education, whereby ministers of health and ministers of education 2 years ago affirmed a commitment to ensure that young people are provided with comprehensive sexuality education as well as services to protect themselves from sexually transmitted infections, HIV, and unwanted pregnancies. Now, it's really a great program because it is already busting myths. Now, in countries that have already started implementing, such as Zambia, Malawi, Namibia, we are seeing that access to information does not increase sexual activity. On the other hand, it is making young people postpone the age of sexual transition. And when they do, they're able to sit down and negotiate safer sex to the point of even refusing unsafe sex. So that's empowerment.
And what we do tend to find is that not only is education lacking, but also the services. And I think David spoke to the prejudices that young people experience when they get to a facility and they are asking for service. So it has to be a complementary set of things, including at the community level, how we work with communities to ensure that, again, the discrimination, the stigma, and actually the vulnerabilities that really are based on things that happen in communities are elevated.
The treatment gap is there. A lot has been done in terms of treating. We cannot now, in this century, still calling the AIDS disease as a killer disease, because we know that strategies for treatment are there. That today we are here to remind ourselves that we know what should be done. We cannot fail our future generation. We are here to keep our promises, and action is now.
The United States under President Obama is committed to the future of Africa, and certainly we understand that a healthy, thriving young people are really key to the success of the continent. PEPFAR, since 2004, has invested over $4 billion US, that's 360 billion Kenya shillings, in HIV prevention and treatment programs just for youth. That's just the commitment for youth. 432 million of that has gone to Kenya, and just last year, $66 million, 6 billion Kenya shillings for HIV prevention and treatment programs for youth here in Kenya. We procure HIV medication, pediatric care, programs to target orphans and vulnerable children, do a number of things. And we have 2 new initiatives launched in 2014, one of which was launched by First Lady Michelle Obama. It's called the DREAMS Partnership. DREAMS stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. And DREAMS is a collaboration with PEPFAR, the Bill and Melinda Gates Foundation, and the Nike Foundation, and it's specifically targeted at reducing new HIV infections in adolescent girls and young women. And up to 10 sub-Saharan African countries, including Kenya, will receive funding under DREAMS. It's a $210 million initiative to support community-based interventions that focused on addressing HIV risk behaviors, HIV transmission, and gender-based violence. We want, through this program and through PEPFAR generally, to help girls reach their full potential. And I think that preventing HIV is really critical to doing this, to achieving an AIDS-free generation. Dreams will help provide the support needed to prevent HIV and to save lives.
And looking at the sobering statistics that have been presented, it's very clear that adolescents should be an increasing focus of our investments. But so often, people talk about adolescents and think what they believe is good for adolescents, but we have to listen more to adolescents. So what we've done to have better programs that address the needs of young people, we've developed a guidance tool for young people to how to engage in policy processes at country level. The tool is currently being piloted, but we're committed to roll it out more widely. Technical support will be made available. We can link to technical support providers to support countries in helping to program for adolescents. We hope that will result in better investment for young people. Thank you.
We have developed guidance for the health workers in terms of the services that they need to provide. If you recall, when David was giving his testimony, what happened to him when he went to do an HIV test. And it wasn't a good experience. So what we are telling the healthcare workers is that they need to know what to do for the young people when they go to them. This document was developed last year, and we have launched it and we are disseminating it at the moment.